Hey there, folks. How's it going? Ryan Kebe here with your Armstrong Neighborhood channel. Thank you once again for joining us as we venture out into our community to discover the individuals and organizations that make our community such a wonderful place. One of those organizations is the Meadville Area Free Clinic, and that's where we are today, joined by one of the founders of the Meadville Area Free Clinic, Mr. Dwayne Kohler. Dwayne, thanks so much for joining us.
Oh, you're welcome. And I'm one of the three founders.
One of the three founders, okay.
The other two,
give me a background.
The other two were Dr. David Kirkpatrick and then Mayor Tony Petruso. And the three of us, and it's funny to talk about this 25 years later, but to set up an organization as a nonprofit or whatever, boy, there was all kinds of legal stuff we had to go through, all kinds of paperwork and all kinds of things we had to go through. But I'd like to kind of go over why it happened in the first place. I worked at the hospital for many, many decades, and one of my jobs was to meet community needs, work out ways to meet community needs. Folks were coming to the ER with kind of crises on hand that really didn't have to be that way. Had they been maintaining time with doctors ahead of time, they wouldn't have had those kind of crises. Heart and lung issues. A big one was diabetic issues. And so folks at the time that didn't have a doctor were afraid of the bill, and maybe they just worked part-time, or maybe they worked at Kmart stocking the shelves overnight, or those kind of workers. And they would have a crisis and come to the ER and then get stuck financially, and so it was a whole bunch of crises, all coming together at once. Folks that hit that category were, like I said before, the folks that worked just part-time jobs and didn't have a medical insurance coverage. Another issue that really kind of like squeaked under the rug were folks maybe they were covered by their spouse's medical insurance, and then the spouse hit 65 and retired, but they still had 2 or 3 years to go until they hit 65 and then were qualified for for Medicare. And so what do I do for 3 years? And so there was a whole bunch of things like that came along. It's like, and so I remember Dr. Patrick and I sat down one time, and it's like, why don't we have a clinic? We can have a clinic for folks, and his big thing was we can prevent them from coming to the ER, by actually doing the regular treatment, and getting them taken care of, and that's the thing for folks that I would still throw that out there is yes, there's emergency care, and they can take care of you, but the better way to go is to take care of things ahead of time and not have an emergency, to take routinely care of
like you
things
said, preventative treatment, right? Things that you're doing, to prevent that crisis situation, like you said. And I mean, just to have this resource for those individuals, like you said, who may not have the financial means, or something's happened in their life where they don't have that coverage anymore, to be able to go to a place that they can get help. I mean, that's huge. And just want to commend
So this would have
everyone
been
that was a
maybe
part
back
of that.
in something like 94, 95, something like that.
Okay.
When Dr. Patrick and I were having that discussion, and like I said, it was quite the complicated process to get everything, because it's former clinic. Okay, no big deal, former clinic, but it was going to be separate from the hospital, and it was to be a nonprofit, and so the clinic has been running for a little over 25 years now, has never charged anybody a penny. Everything that has kept it running has totally been donations. And so, and I would throw that out there for folks down the road. It's like, hey, this is a community asset, and yeah, do a donation, and there will be events and things coming along down the road, and so jump in there and help out. But still, to think of 25 years running, and it never charged anybody a single penny. Never.
Unfathomable in today's day and age for medical care.
And when
right?
it started out, we had a ton of volunteers. We had, I think, 6 volunteer doctors and like 9 volunteer nurses and physical therapists, and lots of others who were all based on that one point. It's like, well, let's keep folks out of the ER. Let's do preventative things to keep them healthy, to keep them well. Obamacare came along, some years down the road, and it never actually got forced that people had to take Obamacare. So the free clinic didn't go away. The free clinic is still here, and people do have coverage nowadays. But the coverage, it isn't 100% coverage. There are still gaps and things.
Absolutely.
And there are still folks who are in that situation that we talked about before. Maybe they were on their family's plan and, spouse retired early and, how are we going to cover these last 4 years or something like that. That one actually comes up a lot. And we still have doctors that are very enthusiastic about volunteering and recognizing the whole big issue and wanting to help out.
That's awesome. And speaking of, donating, events, one of the reasons that we wanted to come by is, there is a big opportunity that you all have to support the Meadville Area Free Clinic, I believe, coming up next month.
Coming up here in July.
Banquet.
Yes.
Could you tell us a little bit about that event?
Well, I'm going to let some others talk about the details of it because I haven't been on the planning of that. But there are United Way has come up with support over the years, and actually Blue Cross has come up with some support over the years.
Very nice.
But events like this, we haven't really beat down the door of things to build events like this because so many people have just stepped up to help out. When something like this does come along, I think that's a great thing. So I'll let the other folks throw out some more of the details about that. But it's in July, I think, in the middle of July. Going to be down at the senior center if I understand
Yes.
right. And there's going to be a bunch of things going on, and there'll be raffles and all kinds of stuff like that. So
Nice.
definitely come out and join that if you can.
Looking forward to it. Well, hey, thanks so much, Dwayne. Like I said, as you said, those three founders, as yourself, for founding this free clinic. Tremendous work, and all the volunteers over the years, as you said, and the doctors that volunteer their time. Amazing stuff here at the free clinic. And really appreciate your time, sir.
Thank you. I appreciate you talking to me about it.
All right, folks, and now we are joined by two of the doctors here at the Meadville Area Free Clinic that so kindly volunteer their time here and really interested in the services that are available here. We have Dr. Amy Miles and Dr. Bev Kennedy joined with us, and could you just tell us, give us a nice rundown of everything going on here at the Free Clinic?
Sure thing. So Ryan, I've been here with the Free Clinic since 2008. I have been a volunteer physician the whole time since that time. I usually volunteer on the level of originally it was once a month, and now I'm up to twice a month providing volunteer clinic physician-patient consultations, management of chronic diseases, and also new episodic and acute diseases as well, concerns. I have been in the medical director role here at the Free Clinic since 2017.
Okay.
And so in that role, I supervise the other physicians and clinicians and volunteer medical staff as well as doing the direct patient care. So here at the Free Clinic, we provide chronic disease management for medical conditions such as high blood pressure, diabetes, high blood sugar, asthma, acid reflux, conditions that people have to take chronic daily medications for and manage their lifestyles for. As well as occasionally, depending on our volunteer staffing, we can see people for more acute complaints like colds, flus, viruses, urinary tract infections, things like that. But it really depends on our volunteer staffing. Thankfully, at this moment in time, we don't have a wait list, but we've had a wait list because of lack of volunteer staffing in the past. But we've been blessed to be able to bring people in within a couple of weeks of their first contact with us. So that works out pretty well, pretty nicely. So that's kind of a general overview of the things we offer here. There's myself, we have another volunteer physician, Dr. Ryan Evans, and we have a volunteer nurse practitioner. Her name is Ms. Brianne Estes, and we just recently got a third volunteer physician. Her name is Dr. Shavya Singh. So depending on what time a person wants to be scheduled, they would end up on one of our schedules.
Okay,
Yeah.
Very nice. And then Dr. Kennedy?
Well, I'm a pharmacist, so I don't want to confuse people with Dr. Kennedy. I'm not a physician. I'm a volunteer pharmacist here at the Free Clinic. I started about 5 years ago with the the need for medications. The clinic was spending a lot of money on patients' prescriptions, so the Dispensary of Hope stepped in, and it's a subscription that the hospital pays for us yearly, and we get medications. It's a dispensary. It comes from a warehouse, and it's excess medications from the manufacturers that's given to free clinics all around the country. So I can order medications that patients need weekly through the Dispensary of Hope. And that's how I started as a volunteer. They needed somebody to help organize that cabinet and storage and proper dispensing of the medications. And so then that worked its way into volunteering for a diabetes clinic. I love working with the diabetic patients and doing education with them on their disease process. So once a month we have patients that come into the diabetes clinic, and I'll do diabetes education and test their A1C. And their A1C is what we use to monitor the disease progression with diabetes. So before they had to go to a lab and pay for that out of pocket, now we have it here at the free clinic, and they can get tested every 3 months like somebody who has insurance would get tested as and the A1C we want, like for a person with no complications with diabetes, is around 7%. We were seeing patients at first in the 13-14% range, which makes them really anxious or possible for more complications to the diabetes the higher that A1C number is. So by decreasing those A1Cs, we're seeing less problems hopefully in the future with these patients.
Very interesting.
So,
and you talked about education, talking with Dwayne, that's a big part of the Meadville area free clinic is, a lot of preventative care and things like that, education. You spoke about diabetic, education and things like that. Are there any other, programs, specifically education, that people kind of, can learn about here?
We just have another pharmacist that I work with that just is now starting to volunteer, and he's doing a hypertension clinic.
Very interesting.
So blood pressure, heart disease, chronic or congestive heart disease, can all be preventative by keeping blood pressures controlled. So we have the medication aspect of hypertension. Now we have the education aspect of hypertension, and the physicians can refer their patients into our clinics to be educated. And the more you learn about your disease, education is power, knowledge is power. So that's what we try to do.
You learn something new every day, right?
Yes.
A wise man told me that once.
And I can focus on diabetics all day long, but it's easier to eat bad. It's cheaper to eat. It's expensive to eat healthy.
It is.
So trying to, sometimes just going back down to showing somebody a portion size, what actually is a portion size, so that they can take that knowledge home and start to use it in their everyday.
We partner with different agencies in town as well for other preventative services. So the Family Planning Clinic in town has been kind enough to see our female patients for their preventative female screenings. And we also partner with Crawford County Drug and Alcohol. So with them, they're very good about helping our people with stopping smoking efforts.
Very nice.
So we've been able to connect people in that level of preventative care. So we have other resources we've been able to pull together for our patients as well.
I also wanted to mention that we have the Pass It On program. So we have gently used medical equipment that the hospital was storing, and with COVID they didn't have any volunteers, so now the free clinic has taken over the handling of the medical equipment. So if you have a need for medical equipment, or you have medical equipment you want to donate to the free clinic, just contact the free clinic.
And speaking with Dwayne earlier, he had mentioned that we have an event coming up next month, a fundraising opportunity for the free clinic. Could you tell us a little bit about that event?
Absolutely. So we're having a health fair, that's going to be held at Active Aging out on Park Avenue. It's going to be Thursday in the afternoon from 2 to 5 p.m. And we'll have multiple booths from different vendors in the community, other providers of healthcare services that will be there letting people know about their availability. And of course, we'll be there as well. So we're actually having free door prizes that can be offered to people as they come in. And that way they can just meet three different volunteers here at the clinic as well as our staff and just have a chat about if we can meet their needs, and if they don't necessarily meet our criteria here for the free clinic, we'll be able to point them different directions, and just to let people know that we're out there, we're willing to help, we want to be a resource for the community. So again, that's going to be Thursday, July 14th, and that's going to be from 2 to 5 p.m. at the Active Aging Center.
And
We'll
I just
be more
wanted
than happy to have people out.
I just wanted to add that the reason for the health clinic is that we wanted to give the community, the partners in caring, coming back, bringing it all around as a part of the community that the free clinic is part of, and we appreciate all their help. And it's celebrating our 25th anniversary of being in the community, so that's what the importance of this event for us.
Yes.
25th anniversary next month. Mark
Very
your
big.
calendars, folks. Thank you so much. All right, folks, and now we are joined by two patients here at the Meadville Area Free Clinic, Janet Burdick and Mike Bizzarro. Thank you both so much for taking some time today to talk to us about the free clinic. Janet, could you just tell us a little bit about, the doctors here at the free clinic and the services that are provided here and, just what that means to you?
Well, it means a lot to me. I'm not a patient here right now because I got my insurance, but when I lost my insurance, I got to come here. The people here are very friendly. They treat you very kindly. And if I wouldn't have been able to come here, I wouldn't know what I would have done because, it's expensive and we didn't have the money to come, on a regular basis to a doctor. But they really treat you really good. And they, if you have questions about your health, they really answer them for you and stuff. And the receptionist is very nice and everything. I don't think without this clinic I would have probably wouldn't even took medicine and stuff because I just couldn't afford it.
Right. And that's the thing that, really just is just universal right now. As you said, the cost of medical care just continues to go up, and to have this resource there for the, the free clinic is just, it's incredible. And Mike, just wanted to see, if you could talk a little bit about your experience as well here.
Yeah, it's pretty much the same thing. I went out of work with disability and lost my insurance, and so I really didn't have a way to get my medicine. I'm diabetic and wasn't taking any medicine, and my sugar was way out of control. And by coming here, they put me back on medicine and got my sugar. My A1C went from 9.5, I'm down to 7.5 now. So they've gotten it where it's getting better and under control. And like she said, the doctors here are very nice, answer any questions, try and help you as much as they can. They'll do what they can for you, make you feel very comfortable coming here.
Yes, absolutely. Well, hey, we really appreciate your time, and thank you so much for joining us, and hope everything goes well. And yes,
Yeah.
Janet.
Well, and they even have a physical therapy room here
Very good point.
that
yeah.
I had to take because I had problems with my neck and stuff. And the lady, the nurse, well, she's a therapist there. She was wonderful. I took it for 6 weeks. It really helped me. And I never could afford to pay what the doctors, and hospital wants for that. So it was really good I had that. And I'm glad that they started that for other people too.
It is fantastic, like you said.
Yeah, I had to do that too for the therapy for my legs to help strengthen them back up. I did the therapy here, and in a way to get back to the clinic, I'll actually come at night and sit at the desk when they have the physical therapy. I'll stay here this way. The doctor's not here alone with someone, and I'll check the people in and spend like a couple hours a week here whenever they need me to, and
Well, thank
help
you
them out for
that.
the therapy.
Yeah, appreciate that. It's a group effort here, right?
Yeah, that's for what they've helped me with. It's kind of my way of giving back.
Appreciate that. Thank you guys so much, and as I said, this clinic here, as you could hear, provides some amazing services from some amazing people for amazing people. So thank you all for joining us here today, and we look forward to seeing you here in the future. Thanks, everyone.